Rocky 99, along with Conemaugh Health System, Somerset Hospital, and the Cambria County Drug Coalition, we've teamed up to continue to fight drug addiction with our Hearts Against Heroin campaign. And today we welcome Sue Mann. She's the president of the 1889 Foundation, also secretary of the Cambria County Drug Coalition. Thanks for coming in, Sue.
Good morning.
First, I need to know, how did we get together from 1889 Foundation? What's the 1889 Foundation?
The 1889 Foundation is the former Conemaugh Health Foundation. The Conemaugh Health System was acquired by Duke LifePoint Healthcare.
Okay.
So the proceeds from the sale of Conemaugh Health System to Duke LifePoint went to the Conemaugh Health Foundation. We had to separate from the health system, and we became the 1889 Foundation.
Okay. So then when the Cambria County Drug Coalition came about, we said we need to be a part of this, with you guys, the 1889 Foundation, being one of the first involved in the foundation.
Initially, how it started, the 1889 Foundation made a matching grant to the United Way of the Laurel Highlands.
Okay.
And so from there, Bill McKinney, who's the president of United Way, and I started talking with DA Kelly Callahan because we knew that some of that funding we needed to put toward the drug issues, drug problems that we were facing. And so when we started to talk about it, we looked and really, said that there's a lot of great programs, things that are being done to try to eradicate the drug problems, but they're sort of being done separately from each other. And so when we looked at it, we said, prevention, treatment, and law enforcement were the key areas. And if we could help to pull a coalition together, we could pull all of those wonderful programs together and really tackle this as a collaborative effort. So that's really how it came about. We pulled in several other additional individuals from within other areas of the Cambria County. We pulled it from, obviously, Drug Task Force, the Conemaugh Health System, the Johnstown Police Department, and other areas where we were able to talk with them and pull them in. They're really the experts. And also what we initially did is we went to the other local funders, which are Lee Initiatives and Community Foundation, along with our foundation and along with United Way. We were able to really provide the funding to get this started, and most importantly, get our leader in place, which is Rana Yablonsky.
Well, nice job on the monies, is what has to fuel everything. So nice job getting all that together. My props to all of you for doing that. Now, how do you say, money-wise, is there return on the investment, so to speak?
Well, from the foundation's perspective, our mission is centered on transforming the overall health and wellness of our communities. And so when we look at overall health, that involves a lot of different areas, areas from safe housing, access to quality, affordable health care, having clean and safe neighborhoods, quality education, after school programs, and, kind of the list goes on and on. So when the foundation looks at it, we feel that investing in this drug coalition, we're investing in a better, safer community.
Actually fuels all those things, right?
Yeah, and it ultimately, makes our communities healthier. So it fits right into the mission of the 1889 Foundation. And really, this coalition is about collaboration and partnerships, and we feel that what greater investment than to make in our community.
As we look at the problems that we face, no one answer is there. So what do you feel steps, strategies, coalition going to take over the next year, would you say?
The coalition has set a strategic plan. We have several goals in place for 2017. I'll kind of highlight a few of them under kind of each of those three areas. So for treatment, improving the availability of detox, inpatient, outpatient treatment, medication assistant treatment services, whatever the individual is looking for, they need to be able to have it accessible when they're ready to make that change
ASAP.
And it needs to be across the county, and it needs to be available. From a prevention standpoint, we really feel that prevention, the key to prevention is getting it into the schools.
Right.
So increasing the implementation of evidence-based drug and alcohol programming. One of the areas that we really feel the need to continue to support is for the BOTFIN life skills training. And basically what that is it's a continuous program that's in the middle schools. Eventually will make its way into the elementary schools and into the high school, to be able to, for children to be able to understand how to cope and deal with life. You know, whatever comes down the pike, if they're having troubles at home, if they're dealing with, you know, drug and alcohol decisions to make, if they're being bullied, if, you know, they're, you know, whatever it happens to be, that they understand how to deal. It's life skills
life
training,
hack, so to speak. Yeah.
Right.
Okay. That's cool. All right, good.
And then, then under law enforcement, we need to enhance community policing, create a difficult environment for those bringing the drugs in and dealing the drugs, for those committing the violent crimes, and then help the law enforcement to be able to seek funding for the gaps in the efforts that they're providing.
Well, great. Thank you for your time, Sue.
Thank you very much.
Definitely, we're all continuing this worthwhile effort, and we appreciate your part in it as well. It's Hearts Against Heroin, presented by Conemaugh Health Systems, Somerset Hospital, along with Spangler Subaru, Martin Baker America, Yeager's Heating Service, First Summit Bank, and Rocky 99.